Hey, Joe Jacko here from JackoMD180.com, and welcome to the 12th day of Lent. Not the 12th day of Christmas, but the 12th day of Lent. And it's time for our 12th Not-So-Wacko Jacko rule of medicine. And that is, Big Pharma makes its money on drugs that are still on patent. It manipulates the medical system to ensure these drugs become the first line of treatment. What's not well appreciated by patients in particular is that new drugs are not necessarily any more effective. They do tend to be more potent, but that comes with a trade-off, and that is the more potent they are, the more likely they are to cause side effects and more serious side effects. So there's always a trade-off in that regard. What the pharmaceutical companies will do is they will send their army of sales rep out to doctors' offices and convince physicians to use the latest and greatest new medication that is still on patent. That's where they make the money. They don't make money much money on the generics. There are even cases where they will trash their own old drug in order for physicians to use newer drugs. We saw a case of that with Merck during COVID with its drug ivermectin, which has been around for 30 or 40 years and has an extremely safe profile. So again, Big Pharma that controls medicine, it wants you to use their newer drugs, but those drugs are not necessarily any more effective than older ones. So keep that in mind when your doctor is trying to get you onto a new medication.